headquarters of common sense.
Talk Radio.
Turns. I want to move on to perhaps one of your specialist areas, David. The U-turn by Sajid Javid, the Health Secretary, over the no jab, no NHS job policy. 80,000 staff in the NHS were set to lose their jobs because they refused to get vaccinated. Now, he's backed off. They're now not going to be sacked. But why did he ever pursue this policy in the first place? We cannot, if we've learned anything from this COVID crisis, we cannot ever have these coercive policies ever again. This is a free country. We shouldn't be saying unless you get injected, you lose your job. That's not right, is it?
It's absolutely not right. And we've been talking about this for weeks and weeks and weeks. And the fact is, it's based on bad science. Remember, having this vaccine doesn't stop you getting COVID, and it doesn't stop you passing it on. So the very fact you're mandating it makes no sense to me whatsoever. Also, as you know, today they've changed the way the figures are reported so that if you get a secondary infection with COVID, it's now counted. Now, although that's going to make the level of COVID infections look higher than it was originally, what it will also show you is the mortality is much lower, which means it is now akin to endemic flu. Now, we do not make healthcare staff have a flu vaccination. It is not mandatory. I believe in body autonomy. And the fact is, I'm delighted they've done this U-turn. But if you listen to Sajid Javid, he made it sound like it wasn't a U-turn at all. And of course, the real travesty here is there are 40,000 care workers who lost their jobs because of the incompetence of this government.
Yes, I was going to ask you about this. I was speaking to someone on the same issue last night, and I said, well, surely in retrospect now, the 40,000 care home staff who lost their jobs because they weren't vaccinated can be re-employed, should they so wish, because that has caused a real crisis. What's happening in the care homes now is a lot of the residents, they're very elderly, of course, a lot of them sort of need minor medical attention that can be handled by care home staff. When they lost all the care home staff, these people had to be transferred to hospital and contributed towards possibly overwhelming the NHS. Didn't happen, thank God, but there's a madness in that. We need to recalibrate, don't we? Offer these people their jobs back.
But also, when you work with elderly people, the most important thing they need is continuity of care. They like seeing the same faces every single day. They get to know their carer. They build up a level of trust with that carer. The fact is that 40,000 of them have been thrown out. Now, of course, they can come back in. But why on earth would you want to come back in and work for an employer that doesn't value you? I think people must be very, very angry about that. I'll be amazed if many of those actually come back in. But the travesty is, of course, the people who are suffering, yes, of course, those people who lost their jobs, but it's actually elderly people. And the way we treat elderly people in this country is quite frankly disgusting.
I agree. And not enough is made of the fact that those 40,000 people who lost their jobs, they are part of, or they were part of a very special community. Care home workers, we all know what they have to do. It's difficult work, put it this way. They have to deal intimately, with people at the end of their lives. Physically, they have to help them. We know what we're talking about, and they do it for very, very little money. They're special people, and they got treated terribly bad, shabbily, didn't they, when they were sacked? And that shouldn't happen again.
No, I think you're absolutely right. They're very special people. I think it takes an incredibly special person to be a carer. I think it's incredibly draining, both physically and mentally. And the fact is you're providing not just physical support to the person you're looking after, but also mental support as well. And yes, it's not a job that I think many people could do. And I think losing 40,000 is a travesty. I think we should do everything we can to try and get them back in. I think one of the other things we need to do also is to make the caring profession actually more attractive to young people to go into it. It's incredibly rewarding to look after older people, to see the smiles on their faces, to brighten their lives with, however you want to do it. When I was a carer of the elderly doctor, telling naughty jokes and making that community come alive. And I think we need more people who are willing to do that and to say to young people, it's a fantastic job, and caring for people, there is no better job in the world.
Yes, my mother, God rest her soul, ended up in a care home, and I used to go and visit her and have some great times in the bar with the old boys.
Exactly. Exactly. And of course, you see that the great thing, people forget, when you're older, everyone thinks you're kind of old, but you're not. You're the same person. You're just a bit older. You still have the same sense of humour. You still want to have fun. It's just your body doesn't allow you to do it in quite the same way it did when you were younger.
Yeah, I'm trying to be more mature, but it's just not happening, David.
Exactly.
I'll tell you.
Exactly.
I'll tell you. Well, why? How can Sajid Javid quantify that yesterday morning it was still vital that these 80,000 NHS staff were vaccinated for the sake of the patients, for the sake of the health of the nation? You know, otherwise patients would be put at risk. It was absolutely crucial. They must be vaccinated. And then by the evening, it was no longer crucial.
I mean,
how can he quantify that?
Well, I don't think he can. I mean, clearly he's taking advice from medical experts. And as we know, I'm already sceptical about a lot of the advice that was given. And I think the fact is that what they've realised is actually, I think we are past the worst of it. If you look at the number of ITU admissions, it's way down. The number of people with COVID in hospital is far lower than those people are in hospital for other reasons other than COVID is what I'm trying to say, the majority of people. So I think we're past the worst of it. We've had the most incredible vaccine rollout. 3 vaccines is enough. I think, you know, there is no point going any further with this. There are other diseases that will come along. And of course, you've got to remember all those millions of people who are now waiting for elective procedures. It's time we got on with actually looking after people with other conditions and stop this nonsense and this obsession with COVID, because we have to rebuild this country. And right now, that is paramount.
I mean, philosophically, conceptually, you know, we must learn lessons from the COVID crisis, mustn't we? I think if God, I hope it doesn't happen. But if we get this again, the government mustn't be so tyrannical, mustn't be so authoritarian, must leave us to make our own decisions about our health, to be sensible. They mustn't treat us like infants again, must they?
Well, it will happen again. I mean, that's the very nature of viruses. You get what's called antigenic shift, and it will happen. The question is, when does it happen? Normally, it happens many decades later. But you're right. And I think you also need to then look at the mix of the advisors. Purely having academic scientists on there is not the right way to proceed. You actually need to have a balanced report from people and the impact that it has, not only financially, but economically, but also what it does to people's mental health, for example, what it means for their physical health. And I think government should issue advice and guidance. And obviously, if there is a vaccine, to roll it out. But yeah, these draconian measures don't work. And I think time and time again, we've proved that all those lockdowns, whilst I agree with that first lockdown because it bought us time, the other lockdowns had absolutely no place, and they did nothing but destroy the country.
Yeah, and we ended up with exactly the same number of deaths, exactly the same number of hospitalisation, exactly the same number of cases. So apart from the first one, none of them achieved anything. And I think the first one, in retrospect, we could have done a Sweden and not done it, but I don't blame the government because we're in uncharted territory.
Exactly right.
Very last question.
Good talk. Hot talk.
Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.